This is a case of a 1.5-year-old boy with right side developmental dysplasia of the hip, which was managed with open reduction and hip spica application 1.5 month back. Today we are going to change the spica, do the pin track dressing for the wire and remove the sutures and reapply hip spica for another 6 weeks duration. So as you can see, we have applied soft roll over the chest up to the mark of nipple and both lower limbs, and we have first confirmed the reduction of the hip joint under IITV guidance. The K wire is still inside and we would like to keep it for another 6 weeks because this was highly unstable kind of hip dislocation. So I am just rolling cotton soft roll and then I am applying 4-inch plaster of Paris over the chest as well as right and left lower limb sequentially. Hip is kept in a slightly flexed, abducted and internal rotated position because that is the position of maximum stability, and we are going to stabilize the hip by giving hip spica in this position. If developmental dysplasia of the hip is diagnosed at birth or in early life of a child, it can be well reduced by closed means without any open procedure, and we can maintain the reduction in pelvic harness. But that was not the case in this child, and child presented to us at almost 1.5 years from birth with dislocated right hip joint. So we had attempted open reduction. After reduction of the hip, we had stabilized the hip with K wire, and soft tissue reconstruction of the capsule was done. And now as you can see, I am almost done with the application of plaster of Paris hip spica. The weakest point in any hip spica is at the hip joint, so we are going to supplement our hip spica by applying a slab which is spanning the hip joint, and then we are going to apply plaster of Paris again on top of this slab. So this is going to make the spica quite strong. We should make sure that there is enough space for personal hygiene. There should be enough space for the child to breathe properly as well as to accommodate any abdominal distension. So after having applied plaster of Paris hip spica, we are going to wait till the plaster gets consolidated, and once it is set, we are going to supplement the plaster of Paris hip spica with fiberglass plaster material. All throughout the child is under general anesthesia, so that is the only way we can apply this kind of plaster in such a small child. So now I am supplementing the plaster of Paris hip spica with fiberglass plaster material. So this material is obviously very strong and this is going to strengthen our hip spica, and this is going to reduce chances of any breakage in future. For such hip spica, usually two rolls of 4 or 5-inch fiberglass material will be required. We are going to remove this hip spica from 6 weeks from today, so that would be 3 months from the initial surgery. And once we remove the spica, we are going to mobilize the child and will keep the child under close monitoring and supervision to check for the status of congruity and future development of the right side capital femoral epiphysis and the hip joint. If we have older child than this age group, there might be other surgical intervention which might be required, such as proximal femoral or pelvic osteotomies. But in this case, we are hoping that we might not require such surgeries in future. This is the post-op X-ray. You can see the hip joint is congruent and well reduced. The K wire is holding the hip joint. Thanks for watching this video.